We have created this short movie to illustrate why we think there is so much potential in using multicolor fluorescence imaging during surgery. Just so that everyone is on the same page, fluorescence imaging during surgery is not science fiction, but already is a reality for various surgical indications. This movie shows you an example wherein a Karl Storz fluorescence laparoscope allows for clear delineation of a sentinel lymph node in a prostate cancer patient. Given the complexity of the patient's anatomy, it is not logical to assume just a single fluorescence signal is enough to address all the surgical challenges. In fact, one may even say we underestimate the complexity of surgery when we state that mere fluorescence illumination of one aspect in the procedure is enough to improve the procedure as a whole. Now fluorescence is available in different colors, as can be seen on the left. This inherently means we should be able to visualize different features using different colors. Surgical fluorescence camera systems, such as the Karl Storz fluorescence laparoscope, have a filtered light source and can filter the light detected by the camera. This means that such systems can not only be used for white light imaging, but also allow for the imaging of different fluorescent emissions. To help you understand how multicolor fluorescence imaging can be accommodated, we prepared a short How It Is Done tutorial. So, the first step in realizing a fluorescent emission in a fluorescent dye is in its excitation. This means the dye needs to be illuminated with a light source that overlaps with the dye's fingerprint absorption spectrum. By transferring light energy to the dye, it becomes unstable. When the dye decays back to the stable state, the energy that is lost is converted into light that is emitted. For some, this may be complex to comprehend, but the most important thing to realize is that a dye always emits the same type or color of light. So in this case, indocyanin green always emits near infrared light with a peak emission around 820 nanometers. When a camera is designed to detect indocyanin green, this means it is able to filter out specifically this emission from light emitted at other wavelengths. Now that you understand the basic concept, it should be more logical that different dyes, each with their fingerprint, absorption properties, and specific fluorescent emission, require different excitation sources and filtering options on a camera. If we start at the lower excitation wavelengths, using a Karl Storz camera as an example, the autofluorescence setting on the light source, basically the illumination with blue light, allows for the excitation of the dyes fluorescein, Psi3, and to a certain degree, even Psi5. The emission setting, meaning the filtering in front of the camera, that matches the excitation setting, then allows for the detection of the respective fluorescent emissions. Hereby, fluorescein is seen as green-yellow, Psi3 is orange, and Psi5 is red-pink, which are the true colors of the light emitted by the respective dyes. If we use far red filtering in both excitation and emission, basically the illumination with red light, we see other dyes light up. Again, the fluorescence is depicted in its true color, namely red-pink. Moving on to near-infrared fluorescence imaging, the same applies, but again the wavelengths used are slightly shifted upwards. Interesting to note here is that near-infrared emissions are invisible to the human eye, meaning the blue coloring seen is artificial. This also explains why different camera vendors may display near-infrared fluorescent emissions with other colors. Even more important than being able to realize fluorescence imaging at 3 different settings, a camera system that can combine all 3 multiple excitation and emission settings can be used to image a whole palette of fluorescent dyes, so-called multicolor fluorescence imaging. We already use this concept in the clinic. In this example, you see how we sequentially visualize fluorescein in yellow and indocyanin green in the form of ICG technetium nanocolloid in blue. We would like to end by stating that multicolor fluorescence imaging is technically feasible, and if it is up to us, this concept is here to stay. Next to technical refinements in the technology, It is obviously key to demonstrate how the imaging of different fluorescent colors can help improve the surgical accuracy.